about other addictive substances, which include opioids, inhalants, and hallucinogens. Next, we are going to talk about opioids. Opioids. So, opioids include things like heroin, morphine, and hydromorphone, which is Dilaudid. They can be injected, smoked, or inhaled. And the intended effect is like a rush of euphoria, so they feel like this extreme well-being or relief from pain. Effects of intoxication include slurred speech, impaired memory, pupillary changes, decreased respirations, and level of consciousness, and that could cause death. Effects of intoxication also include maladaptive behaviors or psychological changes, including impaired judgment or social functioning. And we use naloxone or Narcan to relieve the effects of an overdose. Withdrawal manifestations. So an individual who is withdrawing from opioids, they are going to be sweating, experience runny nose, goosebumps, tremors, irritability, and that will be followed by weakness, diarrhea, fever, insomnia, pupil dilation, nausea and vomiting, pain in the muscles and bones. It's unpleasant, but things like muscle spasms are not life-threatening, and it's usually over in 7 to 10 days. So here's just another breakdown of symptoms of opioid intoxication and withdrawal. So intoxication includes decreased respirations, which that can be the cause of death. Even if an individual has a pulse, rescue breathing by EMS may be needed. We'll see pinpoint pupils, bradycardia or hypotension, hypothermia, sedation, constipation, a nodding head, euphoria, calm, and they will not be able to experience pain. So in withdrawal, we have increased respirations, wide pupils, tachycardia and hypertension, hyperthermia, insomnia, diarrhea and diaphoresis, rhinorrhea, piloerection, anxiety, and bone and muscle pain. So piloerection is the goosebumps and rhinorrhea is runny nose. On the left, you can see an individual who is experiencing opioid use or overdose, and that is the pinpoint pupil. On the right, you can see opioid withdrawal. See how big that pupil is? COWS, or the Clinical Opioid Withdrawal Scale, is a way to measure symptoms during opioid withdrawal. So their pulse, if they're sweating, how restless they are, pupil size, runny nose, GI upset, tremor, yawning, anxiety, and if the individual has goosebumps. And this can be used when they are starting other medications as well. So I just wanted to introduce you to COWS, the Clinical Opiate Withdrawal Scale. Here's a really brief overview of some pharmacological treatment options for individuals who use opioids. So methadone is an opioid agonist. Individuals need to go to a methadone clinic. For this medication, it replaces illegal opioid use to dependence on methadone. Buprenorphine is an agonist-antagonist. A primary care provider can prescribe it, and it decreases the feelings of cravings and can help the individual be compliant. Some versions of this contain naloxone. Naltrexone blocks the mu opioid receptors, and this prevents pleasurable effects. Clonidine helps with withdrawal symptoms, including diarrhea, nausea, and vomiting. And naloxone or Narcan is an antagonist and it treats overdose. Next, we are going to discuss inhalants. And these are usually sniffed, huffed, or bagged, and often used by children or adolescents. Inhalants are often sniffed, huffed, or bagged, and the intended effect is euphoria. When an individual is experiencing intoxication, it depends on the substance, but generally it can cause behavioral or psychological changes, dizziness, nystagmus, uncoordinated movements or gait, slurred speech, drowsiness, hyporeflexia, muscle weakness, stupor, coma, respiratory suppression, and even death. There are no withdrawal symptoms from inhalant use. Now we're going to briefly mention hallucinogens. The most common of these are LSD and PCP. Hallucinogens. These are usually ingested orally, but also can be injected or smoked. An individual may experience a heightened sense of self and altered perceptions. So colors may be more vivid when they are under the influence of these drugs. They may also experience anxiety, depression, paranoia, impaired judgment, impaired social functioning, pupil dilation, tachycardia, diaphoresis, palpitations, blurred vision, tremors, incoordination, and panic attacks. Hallucinogen persistent perception disorder is when somebody who has previously taken a hallucinogen experiences visual disturbances or flashbacks that can occur intermittently for years. Now we're going to talk about patient-centered care for individuals who have substance use and addictive disorder. So the first thing that we need to do in the nursing care is to check yourself. And what is your personal view and feelings regarding substance use and addictive disorders? What does your culture feel about it? What is your own personal history, your family history? You will transfer your feelings onto your patient through body language, speech, terminology that you use when you talk. And in order to be a good psychiatric nurse and to do an effective job when you are working with individuals with any sort of mental health or physical health issues, having a non-judgmental approach is imperative. Otherwise, you will not be able to effectively do your job. So the first thing you need to do is check yourself. We also want to always remember safety first. So safety is the primary focus of nursing care in general, but especially during acute intoxication and withdrawal. We always, under any circumstances, want to maintain a safe environment, prevent falls, and implement seizure precautions if you need to. Provide close observation for withdrawal symptoms. This may need to be one-on-one observation. Orientation for the client may need to be repeated because the client may not be oriented to time, place, person. Make sure the patient is getting enough to eat and drink. Create a low stimulation environment. Administer medications as prescribed to treat the effects of intoxication or to prevent or manage withdrawal symptoms. Monitor the patient to make sure that they aren't sneaking in drugs and using them while they are going through the detoxification period. One time, a visitor brought in McDonald's, and it was a milkshake with whipped cream. And I thought, that looks weird. And I moved the straw and there was a bag of pills hidden in the whipped cream. So you really need to thoroughly check everything that any visitor brings in if visitors are allowed. We want to provide our patients with emotional support and reassurance. We want to educate the client and family about codependent behaviors. And we want to educate the client and family about addiction and the initial treatment goal, which is abstinence. Educate the client in the family to remove the prescription medication in the home that's not being used, or to lock up the stuff that is being used. Don't share medication with each other, and don't take medication that's not being prescribed. We want to develop motivation and commitment for abstinence and recovery. So this is going to include personal growth and self-discovery. I don't personally like the word motivation because motivation is a fleeting feeling like happiness or sadness. I prefer self-discipline. So we want to encourage self-responsibility and help the client develop an emergency plan. What do they need to do and who can he contact in case of emergency? Encourage attendance at self-help groups. So these are things that we can do to provide emotional support and reassurance for somebody who is going through or struggling with an addictive disorder. Teamwork makes the dream work. Many of these individuals have a dual diagnosis, and that means they have a diagnosis of addiction and a diagnosis of depression or anxiety. And so both things need to be treated, and that takes a team approach. Most likely the individual needs psychotherapy, and that's one-on-one therapy. Cognitive behavioral therapy can help decrease anxiety and help with behavior change. Acceptance and commitment therapy promotes commitment to positive change. Relapse prevention therapy. It helps the client identify the potential for relapse and promotes self-control. Group therapy is for individuals who have similar diagnoses, and they meet in an outpatient setting or sometimes also in the residential facility. But it helps with individual self-soothing. In a one-on-one situation, you're still counting on the other person to help you through something. In a group situation, you realize everybody has sort of a similar problem, and you learn how to self-soothe, which can be a skill that these individuals are missing. Family therapy helps with codependency. So a codependent person is over-responsible, and that allows the dependent individual to continue with substance use or addiction. So families need to learn about the specific substances and how to not enable an individual. So this type of therapy might help with family coping, problem solving, relapse signs, and support groups for the family. Of course, pharmacological therapy is medication, and we'll talk about more of this in detail coming up. But medications can be used for alcohol withdrawal, alcohol abstinence, opioid withdrawal, nicotine withdrawal. And part of the nursing consideration will be to educate the client on these medications. Also to encourage the client to adhere to the treatment plan. We want to monitor the client's vital signs and neurostatus and make sure the client is safe. And again, that could be implementing seizure precautions. Care after discharge. So, discharge education is a huge portion of discharge planning. Teach the client to recognize indications that they're headed towards relapse and factors that could contribute. So triggers. I personally don't like the word triggers because it sounds like you can't help it. Somebody pulls a trigger, comes at you, and there's nothing you can do. A trigger really is something that touches an unhealed wound. So we have to heal our own wounds, and then the triggers won't occur, actually. CBT, cognitive behavioral techniques, can help maintain sobriety and to create feelings of pleasure from activities other than drug use. That's really important. We're going to help the client use non-violent communication skills. identify their feelings, talk about what they need, and problem solve. We want to encourage the client and maybe their family to attend 12-step programs. So Alcoholics Anonymous, Narcotics Anonymous, Gamblers Anonymous, and family groups like Al-Anon or Alateen. These programs teach the following. In order to recover, you have to stop using. That a higher power is needed to assist in recovery. For those that don't believe in a higher power, there are groups like Smart Recovery that leave this step out. That they are not responsible for their disease, but they're responsible for their recovery. I have a little different perspective on this, and it's sort of the same with somebody who is a type 2 diabetic. The disease is caused by behaviors that we do have control of. Once we have the disease, it's harder to stop, but the disease is actually caused by us. So I think that's important that we stop the process before it gets to that point. But this isn't a disease that we had prior to eating unhealthy foods or prior to using substances. We also want to acknowledge that we can't blame other people. So it's my problem and my feelings, and I can't blame other people for my addiction. We want to help individuals get to that point.
And that concludes this lecture. Again, these lectures are based on ATI fundamentals.